My pathology is papillomas versus papillomas with atypia. Papillomas occur in the breast in two ways. One type occurs in the larger ducts near the nipple, producing unilateral spontaneous discharge. Another type of papilloma may occur deep in the breast, appearing as a mass. Papillomas, when visible, appear as smoothly outlined, lobulated masses and sometimes have a raspberry-like configuration. Both types are benign. Many papillomas may be hard to see on a mammogram. Papillomas with atypia is if there is proliferation in the breast. If there is a monomorphic cellular proliferation that is 3 millimeters or smaller in greatest dimension and is low grade. Ductal carcinoma in situ may be involved if the proliferation is 3 millimeters or larger or is high grade. Papillomas with atypia have a higher future risk of breast cancer. On the next slide, you can see the difference a spot or magnification view can help see this pathology if you do not see it on the medial lateral oblique or the cranial caudal view. And here we have the left medial lateral oblique and the left cranial caudal views. There, you can't really see the papilloma. You can see the BB here. You can see a little bit of thickening right here where the nipple is. So then we have a spot view. Now you can see where the BB is and how it's going into the ducts. You can see the papilloma. It's kind of a little thicker over here. It's starting to look a little more like a mass, but not too bad. And then we have the thickening and what looks like an inverted nipple going on here, which is similar to what happens when cancer is suspected, but papillomas are benign, so that is the danger here, is that they look very similar to cancer. And then to get a better look at the papillomas, we do a ductogram or a galactogram procedure. A ductogram is a procedure used in papillomas to help identify the source of the discharge. So the doctor presses on the breast to identify the trigger zone. And then doctor identifies which duct the discharge is coming from by doing that. And then a flexible tube is inserted into the duct through the nipple. And a contrast agent is inserted into that duct, and additional images are taken, and you can see more where the papillomas are going through and how the ducts are affected by the papilloma. Prognosis and risk factors. Causes of papillomas are benign tumors that form in a milk duct in the breast. These tumors are made of bland and fibrous tissues as well as blood vessels. Papillomas occur in women between ages 35 and 55. There are known risk factors for intraductal papillomas. The problem with papillomas are that they are similar to malignant masses and resemble cancers, which we talked about earlier. And then single papillomas are not associated with a high risk of breast cancer. Multiple papillomas have been linked to precancerous breast conditions. So if there's just one in there, it's not as dangerous as having multiple ones in there. There's still not much risk factor. It's just the later on in life that it's just connected to having a higher precancerous breast conditions. Treatment options for papilloma. Here we have a slide right here. You can see the papilloma, the mass, and then it goes to have an incision over here where they surgically remove the tumor. Treatment options are a biopsy or surgical removal is recommended for papillomas because of similar characteristics of benign and malignant masses. One way a biopsy can be performed is with excision biopsy or core vacuum biopsy. A core biopsy device is usually 12 to 14 gauge, and a vacuum assisted device is usually 9 to 12 gauge. The second way a biopsy could be performed would be an incisional biopsy done in the operating room to completely remove the mass. And they said that it's sometimes not necessary to even worry about it, but they still remove them. The long-term follow-up, since papillomas are benign, survival rates are high. Studies have shown that papillomas without atypia do not require additional surgical or resection, and patients can follow regular physical examinations. Papillomas with atypia are at higher risk factors for future risks of breast cancer, so they should be monitored more closely than those who were diagnosed with papillomas without atypia. Long-term follow-ups consist of women getting their annual screening mammograms. They just go in for a normal mammogram. Most of them really aren't at risk for anything happening if they have regular papillomas, but if they're with atypia, then there might be a little bit more of an issue. Papillomas are not much to worry about compared to the rest of the pathologies that we have when doing mammograms. Here are my references, and that is it.